In this video today, we're going to see a patient who had a previous migraine surgery by a neurosurgeon. And neurosurgeons are fantastic, but many of them are not well-versed in peripheral nerve surgery. And in this particular case, I don't think that this particular neurosurgeon was really comfortable doing this type of surgery. And so while I do not in any way think that anybody entertaining the idea of headache and migraine surgery should come to me, I do think that it is important to go to somebody who is experienced and well-trained and really understands the necessity of freeing up the entirety of the nerve, not just small segments of it, which I think was the problem in this particular story.
I'm Dr. Lowenstein, and this is our patient, Kristin. And she, do you want to tell what you've been up to or how this all played out?
So I was diagnosed with occipital neuralgia probably 7 years ago. And so I have the pain in the back of my head. That's quite intense, and we're here to get it fixed.
So Kristin had surgery by a neurosurgeon. And so we're going to actually revise the situation. And apparently, you told me that you had it on the right side, and the pain was worse before the first surgery, right? But after the first surgery, it's just a little, it's more point pain, more distal, right? Or higher up. And so what I want to say, and actually, I don't know that we talked about this, but I again reviewed that op note, and it specifically says that the artery was not divided. So I had her point to her pain, which I'm going to do again right now. And let me point to where it hurts. Can you point to where it hurts? Okay. And I'm going to use this Doppler, which is going to actually allow us to hear if there is a blood vessel there. So, okay, right there, okay. And so, I don't know if that's audible. I'm gonna move this towards you. But you can hear the pulsation of the occipital artery. And so, that is a critical, hear that, see if I can get it more stronger. There we go. So that's a critical part of the operation that unfortunately does not seem to have been done. And so what I think is happening is that the artery is still crossing that occipital nerve and causing her pain at exactly that spot. So we're going to go in and revise things today, and we're going to make sure everything is freed throughout its course, but also make sure that we divide that artery, and I think that's going to do wonders for your pain. Okay? That's that story. I just wanted to kind of explain some things, and I hope that helps. Thanks.
So I took some photos during the surgery, and here in this first photo, you can see the greater occipital nerve is demarcated with a yellow loop under it, a little rubber loop that we use to help identify things. And then up towards her scalp, you can see her hair up in the upper left-hand corner, a little dark area. But as it's going up, you can see that the occipital artery branches and actually encircles the nerve, and this is causing significant amounts of irritation on the nerve. So I divided that, and I used cautery to do that, which is why here in this next photo you can see that the artery is like a little stub just divided, and the greater occipital nerve now can just sit in its natural position without compression from surrounding structures, and it's not going to get irritated, and I suspect that this was the cause of her ongoing pain, and this should make things better.
All right, so we met Kristin a week ago. Was it a week ago? And so we got the first part of that little interview, and then got the pictures from your surgery. And again, she had previous surgery by a neurosurgeon. What we found was that the nerve branches were intimately compressed by the occipital artery, which was not addressed at the first surgery. And so we fixed that by clearing out those vessels. And you want to talk about what's been going on for the last week?
Yeah, the last week has been really good. Completely pain-free this past week. Probably in this amount of time I would have had a migraine by now. And I'm happy that hasn't happened. I have a bit of numbness, a little bit of tingling, which is to be expected. But other than that, the recovery so far has been really smooth.